Now, I came across this concept when I was reading about the Dupuytren's contracture. Okay, so I just said, let me just discuss it on a general, all right, because they happen to actually emphasize on it. Okay, so this is general contractures of the subcutaneous fascia. So subcutaneous, when you say something is subcutaneous, it's just under the skin. Okay, so the fascia normally should be, flexible. You contract, you relax. But when it happens to be like a permanent contraction, that's when you now say there's a contracture there. All right. So any fascia at all, once it is under the skin, it could be affected by this. All right. But a prototype example is the Dupuytren's contracture, which you have, here. So this, we said that what it just refers to abnormal tightening. So fascia that is supposed to be, smooth, you contract, you relax, is becoming so tight and stiff. Okay, and that it's under the skin. So because it's tight and it's just under the skin too gets affected. Okay, so it's often due to fibrosis, tissues are dying, scarring, and what's chronic inflammation. So you should know that it lies just beneath the skin, and this fascia is composed of what? Adipose tissue, collagen fibers, and fibroblasts. So provides cushioning. It makes it that everything is what? Smooth, slippery. So it has a difference from the deep fascia. So subcutaneous fascia is loose and more blood supply, while the deep fascia is more what? Strong, okay, and less blood supply. So contracture now is just permanent shortening or tightening of soft tissues. Okay, as their name implies, soft. They are supposed to be soft. So once they tighten up and you are not able to relax them again, you say that there's a contracture. So causes could be due to chronic inflammation or injuries, burns or surgical disease, or surgical scars rather. All right, systemic disease was what I was actually supposed to say next. Then maybe there's repetitive mechanical stress. So the skin, because it is over the fascia, it gets affected. So there's thickening, hardening, or puckering of the skin. Restricted mobility. You're not able to use that part of the body like you were using it before. Okay, pain and discomfort, and functional impairment. Now, diagnosis is physical examination, imaging, and also histology. Okay, you treat it from all those physiotherapy, stretching, massaging, heat therapies. Then you give drugs that will stop further fibrosis. Okay, that's antifibrotic medications. They also give, all those corticosteroids to reduce inflammation. Then, surgical options like fasciotomy and the rest of it. So that's what we got for this.